For our next episode, I'm joined by two amazing women leaders. They are Shannon Humprey from Canada and Almeida from Brazil. Like you two, for me, are like you're amazing and inspiring women leaders. And there's a phrase that I sometimes have in my head, which is, there are some people who are respected, as you both are, but in addition, there are some people who are also loved. And this is really true for both of you. This is a very unique thing, I think, to have, is where people, they do love you. And I think that's partly also because of what you've given back. So your leadership has been to do with achievement, but it's also to do with giving back. So we also want to celebrate that for you both, and thank you for that contribution that you have and the leadership you have within our field.
That is an incredibly kind thing to say. And isn't that what it's all about? It's about the feeling. It's the connection we have to one another. And it's great to crush our goals and to be the leader, but to do it in a way that recognizes relationships and people, and the fact that we're better together. To me, that is what it's all about. So your compliment means a lot.
And just to add something is that we are proud to be together. You know, I'm so proud with you, my colleagues, and so I cheer for you. And I think this is the way that we have to behave with each other.
It's not just us saying it, but that research says that that is also how women work. That they will tend to work just exactly what you said, collaboratively. They tend to treasure relationships, and they want to try and move together rather than individually. Like, have you come across that? And so to get to where you are today, did you come across people playing in the opposite way to that? Like, that was a challenge?
There's no doubt, but I just wanted to give the example of the three of us. Like, we have been so lucky to work together in many ways over the last, for me, 15 years. But the highlights of our working relationship have not been the tangible. They've not been the science or the technique or what you've taught me. They've been the way you made me feel, the little messages of encouragement, the offer of support, the connecting me to a great opportunity. Like, it's that feeling of support and collaboration that really, to me, defines our relationship, and I think allowed me to achieve more as a thought leader. I don't know, Ada, what do you think?
Yeah, I totally agree. And I feel comfortable for, off the cameras, off any meeting, to call any one of you to say, can you teach me something, or can I discuss something? This trust is so important. You make us feel comfortable. I think we feel with each other, and we trust in each other. I think this is so important.
It's so important because I know from Fine that that point where you can see that what you don't know. I recognise it in both of you as well. The ability to be like, I don't know about this. Like, we all have those gaps. To pretend that we don't is just a lie. Like, I have tons of gaps in my knowledge and understanding. But I'll never fill them unless I'm like, oh right, actually, like, can I just go over what I don't know? And those moments are very valuable.
That speaks to vulnerability. And you are comfortable being vulnerable with Ada and myself, which allows us to get further together. And the question you asked earlier was, have you had the opposite experiences? And of course we all have, but there's that opposite alternate moment where your spidey sense is triggered. The hair stands up on the back of your neck and you're like, I don't think this person has my best interest at heart. I think they're trying to kind of step on me to get ahead. And for me, I just immediately pulled right back to that, back from that. And one of the strategies that worked for me is to carve out those people, to Ada's point, where I feel comfortable, where I can be myself, where I can say I don't know. And when I know, where I can say, I know. Like, I am an expert in that. Let me tell you what I know. And that's a beautiful place to be. And I think we can model it for the up and comers, and we can just kind of hold ourselves to that standard.
So your technique then is like, so say for example, you come across, there's like someone who is totally out for themselves, 100% like out for themselves. So like say it's in a meeting, like an ad board, for example, because this is often where you see these things in ad boards, isn't it? Where everyone's, peacocking.
Yeah.
So what is do you feel like you have to act like them to combat, or do you just, you withdraw personally, yeah, but do you also, like, how do you combat that without losing who you are?
I think you, especially when we have males on the sessions, they usually interrupt when we are talking. And I think we have to be patient, but still have the position to give our opinions about that issue or that one. And usually we don't see it too much when we are only female. So I
Yeah,
think we have, okay, we can be calm, we can be polite, but we still have to let our opinion in these meetings.
yeah,
Yeah, I
yeah,
agree. And I think like I would never want to match that energy or behavior. I don't want to peacock to have like to be credible, to have my voice heard. And I'm Canadian. So we are patient and we use a lot of manners. I'm very polite. So I kind of just wait for the right opportunity and to Ada's point, feel obligated to share, but in my own way with manners and with clarity if my opinion is different.
yeah.
It's worked well for me. At times inside, it's frustrating because you want to speak up right away and sometimes be the first or disagree. But there's a way to do it. Really, it's about diplomacy, right? It's about disagreeing with manners. And that's been my strategy.
And I think there's a culture, isn't there? Like I noticed that sometimes there's a culture, like at the end of a presentation. Like it's hard to talk about gender sometimes because I keep coming across that not all men are like this. You know what I mean? So of course, but there is generalizations which are true, of course. And there is a thing that I've observed where in certain times they've done it like anyone has done a presentation, and there's a little bit of a male boys thing where they're like, right, let's try and question this person in the most aggressive way we possibly can. Like, let's go for it. Like, and let's see if they can, weather the storm. Do you know what I mean? It's like, that's a culture. That's a
Well, and
culture.
it's
It's not,
it's let's the aggressive effort to discredit at the end of a presentation, I actually think presents us with this opportunity to do the opposite. Like we should ask questions, we should try and understand more deeply, but the spirit should be both professional, respectful, and collaborative. If we ask those questions, we'll actually make that expert more expert, understand more deeply, allow the whole audience to understand. So I think I know exactly what you're talking about. It's not my style, and I think we can do better, right? We can ask questions with manners, and we'll all get further along.
yeah. And
And
it's,
we see
yeah,
the opposite also. For example, if you are moderating and you have to establish time and you have to alternate from one to the other speakers. And I saw the opposite. Some speakers that are upset because, for example, you cut his time, or at least you advise that his time is ending. And I think it's difficult to become, calm, but I think it's maybe a classic thing of female leaders.
yeah.
Uh,
And
yeah.
sometimes, yeah, that certain speakers, yeah, they will be offended by the interruption. Like,
Yeah. But I did want to bring up, you made a comment about like sweeping gender generalizations, and they're challenging because on one hand, no, all men don't behave one way, all women don't behave another way. But one of my kind of ongoing gender inequality pet peeves is this language from the podium about women. Women want big lips. Women feel that way. And as a woman, it's particularly challenging for me to hear when the voice of the speaker is a man.
yeah.
And just as I can't generalize, a man certainly can't generalize. So I think that's another place we can get a lot more precise is with language. Some of my patients express this, or a common pattern I've observed. But that sweeping generalization, I think, is risky and continues to, in many ways, objectify women, and I see it on the podium.
What do you think, Kate, about this? You are always moderating.
No, the one thing that I think where there's been an aesthetic bubble which did not keep pace with the outside world was the way that we speak about models live on stage, or the way that some people have spoken about them, like in terms of grading and in terms of looks being so objectively assessed, and looking at attractiveness and talking about certain aspects of that woman who's live on there. This I know because I was spoken to by the BBC, for example, who said that they had seen a demonstration, one we would think is fairly normal. They were beyond appalled at the way that that model patient was kind of discussed, to your point, Shannon, was kind of like taught the language about talking about her looks and how important, but the whole thing was like out of step to the progress that has been made in society outside it. So there's like there was, and I think that's changing, a bubble of incorrectly speaking about, especially in live demonstrations. And it's a learning journey for everyone. Mm-hmm.
To that point, like gender aside, if we actually believe aesthetic care is best when we focus on the patient as a being, as a whole being, we're not doing ourselves any favors when we get on the podium and we talk about individual features, cheeks and chins and noses and upper thirds. And, we focus so much on the product. So we're kind of perpetuating this model of transactional care that does in many ways objectify women, when really I think we believe, based on our experience at the bedside, if we get to know our patients and recognize them as individuals and talk about them as people, they're actually much happier with the care they're receiving.
Yeah, 100%.
Can I come back to other, not pleasant ways on the stage, just to share? I never saw any female speaker talking about, chauvinist jokes on the stage or some commentary. I think this is something different that sometimes, I'm glad that it's not so frequently, but sometimes we see chauvinist jokes by male colleagues, but we never saw something similar when we have women speaking about. I want to hear about your opinions about.
I've just always been so surprised, and I don't understand why this kind of behavior is tolerated. And it's challenging. It feels challenging to be the one person to stand up and say, that made me uncomfortable, or that's unprofessional. I don't accept that kind of behavior. And I think, we can look to each other to stand up, but also we can look to industry to not tolerate that kind of behavior, to not invite those speakers back.
Totally agree.
And I think it's a kind of I think so much happens because it just evolves in this way where at the time what's culturally outside in the society spills into it, and then it becomes the norm, and then it happens where people are in it and they're doing it and somehow they didn't even realize they were. There's an element of that where it's like people become unaware of how other people are seeing it, and that's partly because it happens on social media as well, is that any time you're on the stage, that you go up there, you do your thing, then there'll be 6 people who will come up to you and say that was amazing, it was life-changing. And then there's a whole bunch of people at the back who are like, nah. You only ever hear the feedback, which is the people who speak to you. So there's a kind of false sense of reality when we only listen to good feedback, when we don't share ideas and almost think collaboratively about how we should be going forward, just a performance, just to put it out there, then I think that's when we can go astray, when we're not listening to each other and be like, is this the correct thing? And so I think that's partly why those sort of things happen.
Yeah, it's a way.
What do you think? What do you think we should do about it, Ada?
I think we can't stand anymore. Listen, they think. You know, once in Brazil, I think I shared this moment with you, Shannon. Also, it was a section about how to treat stretch marks, and there is a difficult case that was discussed, and there was some female and male colleagues, experts in technology, for example, and the one difficult case, the guy suggested to, instead of treating that woman over there, to change. You know, if it's your patient or your wife, change the wife. I think it was so
Really?
awful. Really. If he was a man and we were talking about big bellies, for example, a
Yeah.
woman would never say that you could change your husband, for example.
No, there's a bar, it's different bars, isn't it? And it's become, we don't even notice that they're there until suddenly you do, and then you're like, what?
Yeah. So what I did in that moment, I started a big woo from the
Way to
audience,
go.
and yeah,
Way to
and
go.
since the majority of the audience was of women, so it was very embarrassed for that speaker because the whole audience started doing the same.
I
So I
love
think
that
we have to do
example.
something.
I think your example is bold and brave, and one of the reasons why I love you. And it shows how social proof can be so helpful. There were probably hundreds in the audience feeling the same way, but no one was brave enough to say boo. But as soon as you did, then we're all like, yeah, I didn't like that either. So I think
Yeah.
the tides have to change, and in our own way, we have to say something. Like, having been on the receiving end of sexist comments on the podium, I always felt kind of resentful that it fell to me to speak up. Like, I didn't discriminate against myself. Why do I have to speak up? But, if one of us doesn't, who's going to? And so I think we can leverage the support of each other and also just provide feedback as promptly as possible. When you said this, it made me feel that way. Because at the end of the day, that's what I would want. If someone had feedback about how I made them feel, I think it would allow me to be a better thought leader and teacher and friend. But it's not always easy.
Exactly. The feedback is super important because that is in lots of ways how people they make mistakes because of that lack of feedback.
And I
And
think
there's
just like socio-culturally, we're evolving right now. We're learning so much about, gender and race and language and inclusivity. And I think this is the time to speak up and say how you feel.
yeah, 100%. And it's interesting also thinking about young women coming up. I've been trying to understand, like, if you look at the established global leaders, women aesthetic leaders, yeah, of which you're two amazing examples. Actually, and at that level, there's quite a mix. There's lots of very strong, very established women. Like if I look at your careers have everything that makes a true global leader, like the publications, the innovation, the thinking, and the having the vision of where you want to bring everyone, and the stage presence and the ability to work with key companies. Like this is the full package for a global educator and global leader. And then we have these women, and then someone else pointed out to me that actually if you look at who's on the stage but younger, like just coming up, that it's a lot of men actually, strangely. And I was trying to understand why this was, though, although if there's emerging global leadership programs, whoever's doing that will pick evenly. But the people who are pushing themselves forward, like, I'm ready, like, put me on that big stage, they tend to be men, actually, young men. So just wondered about your thoughts about that. Like, do you have some reasons why that might be?
I think, if I can say something, is that because young female are also raising their families, and they have small children that they have to cope with family things, children, together with their business and their career. And not always you can have the backup that you need to raise your career. For example, I still have a very good husband that could stay at home together with someone and let me, some people that help us to let me go away and talk. Maybe you can share your experience too, Shannon. And
Yeah,
you, Kate.
your point is so interesting, Kate, because it's probably been over a decade that we've acknowledged the gap in terms of gender representation on the podium. And I know there's been a lot of effort to have more women on the podium, but when you look at the up and comers, there's actually less, uh, which is less than before and less than you'd expect. And I do think, to Ada's point, some of it relates to how you're spending your time and kind of domestic responsibilities in family life. I think some of it might represent a positive generational shift towards focusing on lifestyle. Like, you can have it all, just not all at the same time. I really did focus on building my career from a place of teaching and training and leadership when I was having my family. I have 4 kids, and that was crazy. I barely remember that time in my life. And were I to do it again, I might have just waited, because I think you can still get there. You could just peak a little later professionally, and it might be more balanced and healthy. So I'm hopeful that's the explanation. I'm hopeful it's not pervasive gender inequality, because I'd love to see these women contribute. They have so much to offer, and they represent more than half of our aesthetic providers.
Yeah, I know for sure. I mean, about the children thing, I can't believe what everyone else was doing. Like, having waited and then experienced both things, building my career without children, and then, of course, it's easier because, to some extent, being established, that's an easier time to some extent. But I still can't believe what women do, because, of course, you suddenly have this person who will be more important than anything else, and in the end, so therefore you're like, oh, it's an amazing shift. Although and with families, of course, that is in any case. But the constant juggle, I honestly, I'm like, have underestimated all women who've had children and have successful careers. Oh, Shannon, I have no idea how you did that.
But you know what,
Going
back to your earliest point about women's work strategies and collaboration, I think if you unlock the secret to all women who've chosen to have families and a successful career, there's always a collaboration with other people. None of them did it alone. You know, Adam made reference to her partner, my husband too.
Yeah.
At one point, I had 2 nannies, a full-time executive personal assistant, 20 women in the office, and that's the answer,
And
right?
I have
It
a
takes
nanny
a
too.
village. You can't do it alone. So I do think we should share more strategies that work. You don't have to do it all at once, but if you choose to, there are strategies that I think will allow you to balance and spend your time in the way that you choose.
Yeah, and it's such a valid point that sometimes understanding that you can pace it differently. You can take some time to do that, focus, and then move on. I think that's absolutely true. Sorry, Ada,
I
you were
think
saying.
it's like an athlete. It's a teamwork.
Mm-hmm.
Yeah.
Yeah, it
You need
really
a lot
is.
of people to help you.
Yeah.
One of, one
And
of my
another.
favorite One of my favorite questions that I ask myself is it important to me, and is it important that I do it myself? And so, like an easy example is eating healthy food every night with my family is important to me, but I don't care if I make it myself. So I have someone else cook our dinner. Doing homework with my kids is important to me, and I want it to be me. So looking at those economics of time and then leveraging your team, I think is one strategy.
I love the way you question yourselves and you put it so objectively, Shannon. I think I could be so clear with my doubts and objections. Sometimes I get a bit confused, but I think at the end, we always will find what is important for us and we
Mm-hmm.
make the choices.
But it's true, I get confused too. And I actually get confused on simple things because I confuse what is my duty. Like, somehow I have some things in my mind, which from wherever it came from, that I feel that somehow, unless I've done some basic thing, like if I give away things, like, which for a man would be easy to give away, but
Mm-hmm.
somehow as I give away cleaning or cooking or doing something in the house or like these basic things, they feel like I've sort of slightly, when I give them away, it still takes an effort for me to do that. Like, as an, okay, no, and then I'm like, why? This is crazy. Of course I should be giving them away.
I
Do you know what I
think
mean? Yeah.
my sister-in-law, she's a physician also, a gynecologist. She used to say that guilty is something that has to be with the double X, not with X and a Y.
Oh,
It's just
okay.
something
Yeah,
with the double
guilty.
X.
Yeah,
But you
Because
exactly.
know what?
we are always,
I think it comes down to role models. And I guess luck. My mother taught me to delegate. So, like offloading, cleaning, and cooking, that was an easy one for me. But I think it's somewhere that we can model for the next generation, right? You actually can have support
Yeah.
and make that
not
choice
feeling
for
guilty
yourself.
about it.
Yeah, and not feeling guilty, but yeah, exactly. I mean, it passed quick, but still, I realised it was there. Yeah,
Yeah.
that it's interesting. Also, when I look at young women and looking at the disparity, so looked at some of the research around this, and showing that the tendency for men to put themselves forward much quicker as experts or competent enough to tell everyone else what to do. I also looked at research around confidence. So there was a really interesting study that showed that men and women under 25, their leadership skills are absolutely the same if you measure them when you looked at leaders of that age, but their confidence was very different. So their confidence, especially for under 25, was very different. So once you hit 40, then it starts to even up in terms of confidence between men and women. And you realise that in aesthetics, what's happened is that now we're quite far on. If you actually look at it, we've been doing a lot of work for a long time. So to stand up and say, I'm going to tell all you something, like my new cheek technique or something, like, in a world which has had many, many cheek techniques, there's an element of almost being oblivious to what's happened before, which seems to be slightly more, men are more likely to do that. Which if you ask up and coming women, they will say, I want to do something so that I'm contributing to the field.
Mm-hmm.
Yeah, I think we are afraid not to look like being arrogant.
Yeah.
Arrogant, yeah. And Kate, I think what you're making reference to is imposter syndrome, and we know it's much more common in women. And even now, I'll get on the stage in front of 2,000 people at AMWC and have this brief flicker of a moment. Do I really have something worthy of this audience to hear? And of course, you snap out of it, but those are deeply patterned feelings and thoughts from our upbringing and maybe evolutionary. And I think it's one way that we can help each other. We can be each other's biggest genuine cheerleaders. And I think that really, really helps.
Yeah,
Yeah,
absolutely.
I think you touch in a very sensitive point. And yes, as female leaders, we have to help each other and at least raise the young.
And I think one way for me I'm trying to think about and focus on is, the way that normally works with academia, where you have someone who's young. So, okay, you want to publish? That's brilliant. You do all the work. And me, I've been around for a while. I'll just come along and, give it a little nod and a read over before it goes in. And of course, actually, that's a very hard way to publish, because that means that young person, especially in the places which are we're non-academic, so you have to have some guidance, structure and surrounding. Yeah, that you need guidance. So how do you make up studies out of nothing? So I think in the other way around, what I'm trying to do is when we're doing studies, and something that we're doing with Merz, is where you have a study and then you bring in young women KOLs, but they don't need to do anything apart from be part of it, learn how to do it, be part of the study. They don't have to think it up. So it's the opposite way around. They are learning how to do studies and understand and contribute an amount, but they're not carrying it. And so then they have something to say. They go to a podium and then they have something that they present because they're on that paper, but they don't have to, have thought it all up themselves.
It's the paradigm of that is a parenting paradigm, which is called the dolphin way. And dolphins travel together side by side and they encourage each other, as opposed to the dragon mom who gives the negative criticism and takes all the credit. It's this concept of kind of collaborative and encouraging. And I love that. I always am trying to work on projects with up and coming physicians, men and women, in a more collaborative way. But I hadn't really thought about inviting them in a fully baked project. And I love that, because ultimately it'll be a springboard for them to come up with their own ideas that they can bring us in at a later time.
Exactly.
Just to talk about the mentorship program developed by Merz, it was so good. It's a very nice idea. We could teach different things to our mentees, but we learned a lot from each other, from the mentees and also from the other mentors. I think this is a nice idea that Merz brought up, and that I hope it continues.
I wanted to circle. Sorry, jumped over you. I wanted to circle back to the research that at the same age, male professionals are more likely to put themselves forward as experts. I think there's something around your comment of vulnerability and not needing to know it all. And I wonder if there's some teaching and sharing there with women up and coming physicians, that there is actually this power and credibility in not knowing it all, in knowing what you know and sharing, but not feeling like you have to know all the answers. To me, sometimes that's the obstacle. Oh, there's so many people that know more. Maybe, but they don't know what you know, and what you know is the gift to be shared. So I think allowing ourselves as thought leaders to be vulnerable and say, oh, actually, I don't know about that, and modeling that that's okay, and I'm still an expert, may close that gap on making women feel like they'll put themselves forward.
Yeah, 100%. I couldn't agree more. And I think that's modern leadership. Like if you look, I can't remember her name.
Brene Brown.
Renee Brown. Is it?
Brene with the B. She talks about vulnerability in leadership.
Yeah, that is the way that, I mean, they did studies on leaders as well, where they showed lots of the companies who are really, really achieving and punching above their weight. The more women that they add into those executive positions, the more successful that they are. So when you have combinations, and what they're trying to say is that this collaborative way of working is not just nicer, it's actually more successful. I mean, so my question then is, it is not a perfect world, and also there is a lot of very, self-orientated and very individualistic approaches to aesthetics and approaches to teaching going on, for sure. So how do we change that? I mean, how do we help pull it in the other direction?
You know, to turn the tides is not an easy task. And I think it's one small step at a time. And it's going to sound very idealistic, but I think, you know, we go forward as we would like to see the industry evolve. So we make connections, we encourage up and comers, we hold space for colleagues, friends, thought leaders when they're not there. And, you know, to the best that we can, we really pull back from that jockeying for position. But I do believe there's this, I think it will catch like wildfire. There'll be positive feedback. The more comfortable people feel, the more vulnerable they can be, the more they'll encourage each other. And I think we just kind of all have to lean into it.
Yeah, they can expose who they are in real. Yeah.
Yeah, and be comfortable with that. Do you think like social media, like in terms of leadership, again, there's the same leaning towards a male bias in terms of kind of digital opinion leaders as opposed to KOLs. Do you think that social media is changing the position or is changing some of the dialogue or the leadership in aesthetics?
I think this is, you have two ways. For example, in our country, where we as physicians, we are not allowed to put before and after or something that we cannot for example, show we as a patient being treated. I think this make us lose some space because other non-physician, for example, can show what they do and everything. And for the great public, they can appear as the real experts. I think we have to find ways. We have to be on social media, tell who we are. We have to be known because of the new generation. They were born on social media, and we have to let them know who we are. I just want to, something that came to my mind now is that when we see, for example, male colleagues talk about injecting botulinum toxin in women, especially in lower face and around the mouth, when they never got this kind of treatment in themselves.
Oh yeah, yeah, yeah.
So they inject too much, they put a lot of dosage, but they don't know how is the feeling after treatment because they only treat, but they had never got the same treatment. And I think
And
this is interesting
yeah.
for us to discuss.
And I also think it's interesting that, like, if you think about how much women, like in your practice, your patients come in and they look at you and they're like, oh, hi, what did you have done? Like if you were, I don't know, if I was a heart surgeon, they would be like, have you had any cardiac surgery? I'd be like, no. So
I've always been
it's
really
kind of like we're in it.
I've always been interested to do a study to look at patient decision-making factors around selecting a provider and where gender comes into play, because I do think different personalities gravitate towards a woman physician versus a male physician. I've always personally felt that it helped me provide better care to be a woman, to understand the experience of aging, and to Ada's point, to have really received the positive psychological benefit of many of the treatments. And no, we don't have to try all of them. And no, I'm not exactly like all of my patients, but I think that shared experience brings us closer together to like it. I think I have a leg up as a woman in that I can understand the experience of many of my women patients better.
That this is the point that we can explore a little bit more. Because
And I think you're right, Ada, that there's an assumption. Yeah, what you're saying, if I understand, is what you're saying is because it's a medicalized, because it's a physiology thing, like, okay, we relax this, we do this, la, 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 then that therefore means that this is what is wanted by that patient, by that female patient, because everything adds up to an outcome, but the next step, as in does that woman want to have that level of, immobility, for example, or feeling on the lower face? Like the fact that she can't bring her mouth down and look grumpy, that may not be what she's looking for. She may well indeed want to look grumpy when she wants
Yeah.
to.
Yeah.
That can be
I think
important.
Yeah. And I think it goes to the whole thing about the math. I know it's a controversial subject, but the mathematics of beauty. Just what do you like? The difference between the maths and the where you create more and more symmetry, more and more perfection, more and more everything is by the book until eventually you lose individuality, or there's a kind of weight, and there's something in that which I think is part of
The science and the proportion and the math, I think, is part of training that's important to understand. Basically, teach us about the evolutionary underpinnings of beauty. But where I am today with my patients, and I really believe it's the best way to be, is to focus on that connection, to focus on the individuality. And the only way I'll connect with my patients and understand their individual goals and needs is if I stop and listen, if I ask them questions to gain a deeper understanding. And to me, that philosophy and that strategy towards patient care does have a gender bias. Like, it's a very woman-led strategy to try and connect at a deeper level to patients. I think any provider could do it, but it all starts with listening and recognizing that we're not all the same, regardless of gender and race. We're all different, and we see things differently.
Yeah.
100%.
And sometimes we see the opposite. You come and you just want to fix that nose that you consider that is not okay, but it's a family nose. It's something that is the future of that face. And I think it's what you talk is very important, Shannon, because I think we have to listen our patient, and maybe it is easy for us as women.
Yes, that's 100%, and it's shown. Research shows that women will listen, they'll practice collaboratively, and I think what also is because the core and the truth behind all that is that how people feel about their aesthetics in general, like how they move through the world, how important what they look like is, because some people it's not important. So the risk-benefit balance is always going to be too high because they don't need to look like that. They're a farmer, or they're maybe this is a generalization, but do you know what I mean? This is not how they move through the world. Mm-hmm. Other people, they move through the world looks first. So therefore, one line, one wrinkle, this is extremely important. Other people, like Ada, you say that certain aspects of their face hold certain importance, which is not measurable by maths. So the asymmetry or the nose it is holding importance which is intangible, that are immeasurable. And so unless you really understand your patients and collaborate with them, you may make the best maths that you can, but you will always fail in treating that patient.
Mm-hmm.
Yeah.
Beautifully said.
So here's a question, which is, how, as women, do you compete? Like, there's no doubt that it's competitive to get to where you are on lots of different measures, which is your publications. Like, you've done amazing publications. Ada, your publication, like on the platysma, changed my world. Like, you've competed on so many different levels, like, and when I look at Shannon, look at the set of you, not only on all your publications, but also on the set of your clinic as well. Like, it's really remarkable. So you have to be tough. Yeah, you have to compete. How can you be tough without losing who you are? How can you be recognized without pushing your way and boasting about it?
I think, first of all, you have to know who are you and what is your identity. And I think this is the first thing. And you don't have to try to be someone else or to live
Yeah.
someone else's lives. I think this is the first thing. When people know that you are talking about yourself, you are telling the truth, they believe in you, and then you become a real leader because you are not
Yeah.
trying to do something else. And I think this is, for me, the most important thing. How
I
about you?
see it. I see it the same way. I am very competitive with myself, but I've actually never strategized or had an outlook to be competitive with colleagues. It was
Yeah.
really more focused on what do I want to bring? What do I want to give? What's the meaningful contribution I can make? And then
Yeah.
very intentionally avoiding the FOMO, like worrying less about who got what other opportunity. There will always be more. And one of my mentors, Doris Day, the best piece of advice she ever gave me was there's room for all of us at the top. And the
Yeah.
more one of us shines, the more we all shine. And I believe that to be true. And sometimes in your lowest moments, it takes a bit of a pep talk. Hey, I am good enough. I don't need to worry that Kate got that podium opportunity or Ada got that publication. It makes us all better. So I think focusing on knowing your own value and just leaning into what you can bring and contribute will keep you on the straight and narrow.
And sometimes you bring someone, and sometimes someone brings you. This is,
Yes, that really helps.
Yeah.
yeah,
Yeah. That's right.
this networking. I think this is the most important thing. Give you ideas and also give you opportunities.
Yeah.
And I think the underlying throughout our whole discussion has been the fact that these are female strategies, very strongly female strategies. Collaboration, lifting each other up, understanding each other, understanding the minds of each other and our patients. And what we see is that this wins. Collaboration, this wins. It beats other things.
It wins and it feels good. Like
Yeah,
we are
exactly.
tribal by evolution. Like all the good
Yeah,
hormones in the fields come when we work together.
yeah, 100%. So this is amazing. Thank you both so much. It's been the best conversation, and I think what we've been talking about is it rings true, and I think that if we can pull it a little bit in that direction more, then I think we will all benefit.
Agreed. Thank you,
Thank
Ada. Thank you, Kate.
thank you, Rose.